John Dave Duenas is here with us. He is a COVID survivor, an IT expert, and what else? Multi-hyphenated ka na subong eh. But this, of course, is a journey into your life, and thank you for allowing us.
Thank you too. I think I would want to add to that I'm a dad of a 9-month-old baby.
Oh, and you became a dad in the middle of
the pandemic.
Yeah. ECQ, to be more
ECQ,
precise.
yes.
Now, thank you for joining us, and let's take a look at your journey over the past year. No? Kaya exciting. You became deputy for data management of the Emergency Operations Center. One of the volunteers sang Bacolod.
Yes.
And you get bashed still.
Yes. I have my fair share.
All right. Sir, how has it been? How would you describe your journey over the past year?
Well, I think it basically moved me out of my comfort zone. As early as April, I thought all the while we're going to be one of those companies that would have to fold, because pandemic actually put a big strain in terms of our cash flow.
By the way, a bit of context. You are the founder of Hybrain.
Yes.
Tell us a bit about that.
Hybrain is a software company. In 2016, we started with 4 programmers. We are more into the full spectrum of software development. But in 2019, we moved from a very broad stroke of software development to focus with healthcare IT. In 2019, we were awarded as the outstanding startup for artificial intelligence and machine learning for the Philippines. And then we also represented the country in the ASEAN contest on the same category. In 2018, I was very happy to say that we are the only non-Manila organization that was invited by the Department of Trade and Industry through the Board of Investments and the Healthcare Information Management Association of the Philippines to be with the Philippine team for the Philippine Roadshow in the US. More of during that time, we were more of selling the services of the Philippines as a market for IT BPM, focusing on healthcare IT.
And your company was actually commissioned by San Miguel.
Yes.
To do
the first COVID-19 automated testing center in the Philippines.
Operational until now.
Yes.
And you have a few other commissioned works right now.
Yes. We basically are focused on integrated hospital information system. And so much so, I guess, we could more on discuss with what our value of the information system is in the healthcare industry. I would always have to brag about how San Miguel chose us, because we're not based in Manila.
Indeed.
We're based in Bacolod, but when we were tasked to submit a proposal and then go through the meetings with their entire procurement team, we were quite shocked and amazed at the same time that they trusted a very young organization based outside of Manila to service their COVID-19 testing center.
But you were supposed to fold up.
Yes.
Tell us something.
When the entire pandemic hit us, it started with March. It started actually personally with me. I was in Manila February 27 until 2020 for a meeting for the National Kidney and Transplant Institute for a possible project with them. And then when I went home, I had shown these symptoms. I was number 7 in terms of the PUIs in Negros. And then March 12, my test came out and it was negative. But March 15, I could not forget it because it was my birthday.
Oh.
Midnight of March 15, crossing to March 16, the executive order of the mayor came out hours after the president declared community quarantine for Manila. And I think during that time we were all affected, because I think with our way of working, we developed a system for hospitals. We're trying to elicit change in terms of how healthcare professionals use information and communications technology, and the transfer of knowledge from an IT perspective would entail you to handheld the end users. So if you're going to cut down that kind of expertise, that you would be there in front of a doctor or in front of a nurse to teach them how to use the system, parang we're making it more challenging for them, because we're not just changing the way they do their work, but we're changing their mindset in terms of how to use a system to assist them in servicing the patients. So April, if San Miguel did not happen to us, I think we would have been one of those startup companies that might have pivoted or folded.
Oh.
The problem actually was that as early as the second week of April, I was having a discussion with my management team that I said, if we are not going to get a project, because some of our projects were put on hold, we might have to declare a temporary closure of the operations or temporary hold of the operations. And good thing that, San Miguel got into the picture, and then 2 new hospitals came in, and then it kind of gave us also the kind of dynamics that during the time of the pandemic, we were smack in the middle between digital transformation, wherein a lot of organizations are moving towards digitizing their operations, and on the other spectrum, the healthcare industry that needed help because of how they responded to the pandemic. So it gave us the kind of leverage in terms of servicing an emerging market, which is very, very strong.
So it's a story of 2 narratives folding in. Your personal survival with COVID. By the way, si John Dave was diagnosed with COVID only recently.
June 16.
June 16. And of course, tapos ka na quarantine, no?
Yes. If not, I might have put everyone.
And the next is your professional survival.
Yes.
Incidentally, it was COVID that allowed your business to stay afloat.
Yes.
And it was COVID also that nearly killed you.
Yes.
And some members of your family, I would suppose.
Yeah.
Tell us about that harrowing experience.
I remember that I received a call from my sister. And then when she was talking to me, I was telling her, you don't sound good. Because it's more like a clogged nose and a hoarse voice. And then I said, what's going on? And then she said, I'm having body malaise. A typical misconception that it's just an allergy, it's just a typical flu. And then for me, having to work with doctors, I know that symptoms like that should not be taken for granted. So I said, why don't you get yourself swabbed? And then for us to know what's really going on. She got swabbed on a Monday. Tuesday, we got the result that it's a positive. I think it's very inherent within my family that everyone's stubborn. So when she got the result of a positive, I was asking her, would you want to go to a hotel quarantine facility or to a facility that is provided by the government? And her being, thrift, if I may say, or her stand during the time was actually more of, if I'll be in a hotel, I could not leave the room. Whereas there's a certain quarantine facility that they are allowed to go out of their room, get, sunlight, and get an exercise. So she opted for the latter. 3 days after, she was experiencing already shortness of breath. And then everyone in the family got exposed to her. So everyone in the family had to be quarantined and isolated, subject to the 5th day swabbing. When she said that she has a shortness of breath, I said, that's not good. So I talked to her doctor, and the doctor said, even though she was still in the quarantine facility, the doctor told me at 7 p.m. to look for an oxygen tank.
Oh.
Because the O2 goes down and it's erratic. At 7 p.m., there's no facility that would be able to lend me an oxygen tank. I had to post on Facebook.
And this was on the 2nd day?
3rd day.
3rd day.
Good thing I had a good friend who made me borrow the oxygen tank, and then when I gave it to her, when I had to bring it to the quarantine facility, the following day, her O2 sat is very dependent on the oxygen. That if the oxygen, the cannula, will be taken out of her, her oxygen will go down to 85. And then the doctor told me, JD, it's not good. I think we have to send her to a hospital. Jules, my company works with hospitals. I have connect with doctors. But on that 4th day, I had experienced how it is that my sister will have to be in a tent.
Wait. So you know a lot of people in the hospitals, and these are not rank and file workers.
Yes.
These are officials.
Yep.
And you could actually ask them, oh, pwede ko da ka kwarto. But your sister stayed in a tent?
Yes.
Why so?
During that time, the entire hospital was fully occupied.
Ooh.
There's no available bed for COVID positives. And our occupancy rate for the entire hospital, not only in Bacolod, but in the entire province, was hitting 92 to 93%. Yes, it was too easy for me to talk to the vice president of the nursing, who actually oversees ER of the hospitals, but there's no available. The ER isolation of that hospital was actually, it's not that comfortable, but I would not discredit that they've really been a big help to us. For 2 nights, my sister will have to stay in the tent. The isolation facility of that hospital doesn't have its own toilet.
And the tent was
It's
outside the building?
It's outside the building.
Parking lot?
Yes. There's a parking lot, and then the funny thing was that the toilet was across the parking lot.
No aircon,
No aircon,
fan.
no electric fan, and that was the first time that I was so paranoid with COVID. I was so scared of it. But during that time, nobody could flush my sister's urine on her bedpan. So I had to go and get the bedpan and flush the urine in the toilet. The funny thing, because I know that I exposed myself. The second one that we found out was that our mom got the infection also.
Oh my.
And then she was developing symptoms. I mean, them being stubborn again, she was claiming that it's only an allergy. And then the next one, I found out that my youngest sister, got infected together with, she got 3 kids, one 3-year-old, 1-year-old, and a 2-month-old. Her 3-year-old baby and a 2-month-old baby got infected at the same time. But good thing that they're all asymptomatic, so they were able to stay in the hospital, in the hotel, I mean. Aside from that harrowing experience of looking for a facility that would be able to accommodate your family members, the sad part was actually more of how costly it is, and there's a scarcity with the supply of the medicine. The hospital called me up at 4 p.m. and told me that the first call was at 2 p.m. and informed me that they ran out of one medicine.
So may kwarta ka, you have the money, but you can't buy that medicine because it's not in stock.
It's not available.
And we're talking about remdesivir?
Remdesivir.
And tocilizumab?
Yes, and tocilizumab. And the funny thing was that I don't know how it feels for other people, but during that time, I felt so helpless. I was driving and I had literally had to park at the curb because I have to cry. Because I don't know. During the time, I was the only one that could move around because everyone in the family, there are 3 households, all of them were all isolated and quarantined. It's a sad state of affair, but it gives me that kind also of frustration and disappointment that no matter how much capacity you have, no matter how many people you know, if the medicine is not available, it's not available. And if it's not going to be administered to your sister, during the time, my sister has a bilateral pneumonia already.
Oh my.
That's why there's shortness of breath na. Her 2 lungs were hit na by pneumonia, and even though she got the first dose of the vaccination because she has comorbidity, it was hitting her hard also. And it was painful. But I'm very much happy that I got friends in the industry. I had to call friends in Iloilo to help me out if they would be able to source out the medicine for me. And even remdesivir and tocilizumab, because it's under the emergency use, they're not supposed to sell it to patients that are not within their hospital, because that's actually the stand of the Food and Drug Authority. But it was really a hard situation. And the funny thing was that 3 weeks after she survived it, I got infected.
Oh my.
It was a
But wait,
sad...
ang ginang-istorya mo looked like a scene from a post-apocalyptic movie.
Yes, honestly speaking.
It's like I Am Legend or World War Z.
Yes. You're
Those
talking about
zombie
Will
movies.
Smith and Brad Pitt.
Brad Pitt. You alone on the road looking for medicines. Ang imo nga sister ara sa tent. Can we say dying?
Yes, literally, because the first time when she was transmitted from the quarantine facility to the hospital, she was pale. Like literally pale, and she was running out of breath.
The only thing absent in that movie of yours
Are the
zombies.
But I could have been one, I think.
But you have the virus actually.
Yeah. Yes.
Wow, scary.
It is.
Now, pag-abot sa imo, nanong tabo? Saan ikaw na?
When it was me already, it was challenging because I have a 9-month-old baby, and even though he has a yaya and I have a helper at home, there are still things that I don't know how to. It's a different thing when you're looking at it that it's your family that was infected, but it's also a different thing when it's you that is infected.
And who was attending to you?
I was able to enroll to the home care facility of Riverside, which is really a big help because during that time, still there was a scarcity of hospital beds, and that every day nurses are visiting me, and that every day Riverside is monitoring my health and how it is. But there's that stigma in you that I remember that during the early stages of the pandemic, when Bacolod was under ECQ, I was having this conversation with Doc Heck, and then Doc Heck was telling me that the problem that we have with the virus is that it's a new pathogen. So there's no strong study, there's no strong white paper that would support in terms of what really is the characteristic of the virus. What will be its effect in terms of during the infection or the post-infection. And actually that I think added more of a stigma to me because I don't know what's going to happen. I mean, my son is only 9 months old. The healthcare industry as a whole is being spread so thinly that if something would happen to me, I don't know if I'd be able to get the services that I deserve, or the kind of service that a positive index would be able to get. But I think one thing also that made me survive was the fact that I was able to get my second dose of the vaccination. Mm-hmm. So it kind of helped my entire immune system to cope up. And basically, I had that kind of belief that, yeah, things will be okay. Things will be okay. But just it's a different story when you're fighting a pathogen, and then at the same time also your mental health is being questioned. Mm-hmm. Because you are going to be confined in 4 corners of your room, of your bedroom, coming from the trauma of your experience with your sister, and then with all of those issues that I experienced how it was to look for a medicine, and then with me and my son, who's going to do it for me? Because my family is also recovering, I would not be able to expect that they are going to do it for me, but it's more of what will happen if, I would go haywire. The funny thing, because it came to a point also that I was having a discussion with my second-in-command in the office, and I was telling them, I know it's going to be quite an overreacting thing, but we have to now decide in terms of if my case would go haywire, the entire operation should not be hampered and should not stop. And those are the kind of thoughts that are running in my head. Like, aside from my thoughts about my son, I have to think of the 40+ people under me that, if we would not be able to survive, if I would not be able to survive this, it should be able to still continuously and sustain the entire operations. So the worry, the health issue, it's going to get its toll on you, and it's going to hit you bad.
It's basically an austerizer.
Yes.
Your mind is in a blender.
Yep.
And that is why mental fortitude is very important.
Yes. And support system. Support system. It's a big help that I think I was able to talk to my friends. It was more of, I don't think I was undermining my family's, capacity, but it was more of, I knew that they went through the entire trauma of 7 out of the 16 family members tested positive. And here comes me, who was running around for everyone, get tested positive also. So it was more of, I would always give them the assurance that I'm gonna be okay, things is gonna be fine, I'm taken care of. But yeah, it's a different story when you have the support system behind you. And I think an OC person like me gave me the kind of assurance that if something happens, I know that people behind me, in terms of people in the office or people in my circle, would be able to take good care of those responsibilities that I would be leaving behind. And yes, I was entertaining those kind of thoughts already. Like, what if I die? What if I will not survive it? I know people are saying that I get vaccinated, I'd be able to survive it. But again, the vaccination is very young. The pathogen is very young. It hit the entire, the global scale in 2019. And it's something that you don't even know what's going to happen next.
But you never thought of killing yourself?
I did.
You did?
Yeah, no, I did not.
You did not?
Yeah. But it's just more of, I was just thinking that if something happens to me, things should be in place, especially for my son, especially for my team. Because I think our legacy as leaders in terms of, being a father to your son or being the head of the organization is that without you, things should still churn out and things should still be able to run smoothly. And I think I was able to get that kind of notion. And that even though people in the office would always tell me, oh, don't stress yourself or don't work too much, leave it to us, we're going to take care of it. But there would always be a time in the day that weird thoughts would get into your mind. Because the problem with COVID is that right now you'd feel okay. In a span of 2 hours, you're just going to change. That you're going to run. Parang you're going to feel the body malay again. You're going to feel feverish, and you think that things will not be better. And that is quite very typical of how an infection runs. And you could never be assured of anything.
It's like breaking up with your first love. Huh?
Yes. You don't know if you'd be able to,
I will survive. But the next thing, nakita ko naman yung iyang panyo.
You get to be reminded. And actually, it's just really more of, my default would always be the trauma that I have gone through with my sister. But at the same time also, the crisis management is kicking in that, okay, don't think about those. Think of what has to be done, what should be done.
But in a way that is very instructive and inspiring because, as I've said, mental fortitude is very important, especially now. Mas snap lang I'd better leave this world because it's a cruel world.
Yeah.
But you have to keep at it. And coping with trauma requires, one, intellect, very important, 2, resources, 3, social connections.
Yeah.
And a sense of purpose.
It is.
That's what I've learned, no? And that's very interesting because we don't think about these things. Ay, ginbiktima ako sa kalibutan. But at the end of the day, you can't do anything.
Yep. It's always about that existential question of, why do I have to exist? Because at the end of the day, when things are illogical na, like you can't, you could not get the logic of why things are happening. The only thing that would keep you focused is that when you know why you exist and that there is something that you have to do about it.
Existential questions.
Yeah.
And then there comes the question, if a tree falls in the forest and there's no one around to hear it, would it make a sound?
Exactly.
Ako lang isa, kung mapatay ko, may makir because no one is around.
Yeah.
But at the end of the day, you go back to what Albert Camus said. Existentialist na siya, ha? Nagamba siya nga, you don't find the meaning of life looking for it.
Exactly.
You find the meaning of life by living it.
You experience it.
You experience
really
it.
have to experience it.
Because amo ni ang problem sa Facebook because we tend to discuss too much about existential stuff, at the end of the day, you forget to live.
Yeah.
You know why? During my stroke, I was actually, after my stroke, I was thinking about it. Anong meaning sang kabuhi? Pinahan ko sang kalibutan. And then one afternoon, I saw someone, kablo ka diin. Every 3 o'clock in the afternoon, may tigulang nga lalaki nga nagapulot sang basura sa basurahan ko. Are sa
Like a scavenger.
Scavenger at 3 p.m. every day. And then I was thinking, wala na ni siya time maminsal sang meaning sang kabuhi.
Survival mode.
Survival mode. Which you actually did.
Yeah.
To survive. Bodo ka hindi angayan nga i-cremate ka, no?
Nga daw ka dyan, nga daw abo na lang yan tayo.
Well, very enlightening, that one. You came from a traumatic experience and then ikaw naman.
Yes.
And you survived. Ano ang nagpa-survive sa imo?
I think it's more of when you knew for a fact that people depend on you, you would not be able to think of your own insecurities, your own worries.
Sense of purpose.
Yeah, it's always going back to your sense of purpose. My son his room is across my room. There's only a hallway that separates us. When I hear him cry or I hear him laugh, I would always cry.
Ooh.
Because I could not leave my room. That's actually one of the the strangest guideline of Riverside during that time, that I could not really leave the room because I would be exposing everyone in the house. And whenever I hear my son crying or laughing, I'd always tell myself that small human is very dependent on me. If I will not be fighting this, I am not just giving up on him, but I am giving up on life itself, which is it gives you the kind of purpose when you become a father, because you would always think about your decision would not just be about yourself, but what would be best also for your son. And second, when you also came from a startup realm, your members become also your adoptive kids.
Indeed.
Well, yes,
indeed.
whether
I
you
can
don't like
understand.
it or not. And you're also thinking about when people think that your utility is actually your smallest position in the office, but for me, our utility people in the office would be my barometer in terms of, was I able to take good care of them? Does the management understand its role in terms of making sure that everyone knows what to do and how to do things?
And I have discovered that during the pandemic, it is harder to be an employer than to be an employee.
Oh, yes. You'd be thinking about cash flow. You'd be thinking about not only about deliverables. You'd also be thinking about how is the team doing. You can't be just so focused with their productivity, but you'll also be thinking about how is their health, how's their family, health in terms of not only with physical health, but also with mental health. And if you go to the spectrum of understanding the Filipinos in terms of the dynamics, we're very social people. And if you cut down that kind of social exercise, you don't know what kind of effect would that be. I was able to experience 3 of my members were tending the resignation because they don't know if they're still happy with what they do. And it was in the middle of the pandemic. And it's just about us also appreciating our talent management team, that they knew for a fact that when people get into that, it's not about working environment, but it's always about the effect of the new normal or the regular, the new regular things in terms of how people think and how they would act. So we were able to, establish programs also on how to support it.
And it's a combination, actually, of management support and your individual drive.
Yes. Yep.
Now, you have to find your way. You have to be, in a way, self-motivated. Okay.
You have to carry your weight, because if you would not be able to carry your weight, everyone is fighting the same struggle as you are facing. Everyone could not freely do what they want to do. Everyone is so concerned about, the effect of the infection with their family if someone gets infected. Everyone is so concerned with what happens next. Tomorrow, will we be able to get the same business? Are we still able to survive it? Would we have, the same funds that we had the pre-pandemic? And the curtailment of the movement is actually not just going to be with the basic necessities, but it's more of curtailing the entire movement of how we do business before. And that basically changes a lot of things.